When we think about healthcare and trying to provide the best delivery of healthcare, healthcare is a science, but it's also a significant portion of it is the art of science. And relationships, I think sometimes we discount or dismiss how important the relationship between the doctor or provider and that patient can be. My name is Tito Izzard. I'm a family physician and president and CEO for Milwaukee Health Services Incorporated. We're located predominantly on the north side of Milwaukee, so 85% of our patients or customers are African American and live in the central city of Milwaukee. People who historically have been disenfranchised, there's a certain level of mistrust in the healthcare system. I think sometimes we discount or dismiss how important the relationship between the doctor or provider and that patient can be in that person's healing process. And so having someone who you can, most importantly, someone you can trust. My job is to make sure that we ensure that all our patients in the community receive access, which is timely, appropriate, and cost-conscious, receive culturally compassionate customer service, so that's being delivered in a manner that reflects and represents where the patient's experience is coming from, and then also ensuring that it's the highest of quality of care, trying to get the best outcomes to reduce health disparities.
My name is Maria Elena Perez. I'm Vice President of Behavioral Health at 16th Street Community Health Centers. I'm a psychologist by trade. With mental health care, we know that there are populations that don't even have a language for mental health. It is not included in their worldview. They have historically engaged in their faith-based community. They practice more indigenous kinds of interventions. They rely more on family for their spiritual and psychological care. So we're talking about models in the Western world of mental health care that may be new or newer to those who are not familiar. So that is again one way that having the representation in mental health care is vitally important, because they understand that going in. We have a very diverse team here at 16th Street, and when we talk about cases, we challenge one another to look at it through the lens of multiculturalism, through the lens of health disparities, through the lens of traumatic experiences of those who are not of the dominant culture. So I myself have witnessed a shift in this community with mental health, where our community members are more willing to seek mental health care. And I do attribute that to the quality of providers and the representation that we have in our behavioral health division. Representation is the key to providing excellent health care for everyone.